We're joined today by State Representative Maureen Madden. You're sponsoring legislation that protects renters as they're dealing with the coronavirus pandemic. Can you tell us exactly what your bill would do?
Sure. Well, my co-sponsor, my prime co-sponsor is my colleague, Representative Mike Schlossberg from Lehigh Valley. And what we're trying to do, so as you know, there are already many low-income residents in Pennsylvania who already are struggling to make a living. We all know that the average person can't afford a $400 out-of-pocket expense. So certainly we expect landlords and tenants to be hit so hard by the COVID virus. So our bill looks to do three things. It looks to require landlords to create a payment plan option for tenants that may have lost income due to the statewide emergency COVID. And in addition to that, it will put infrastructure in place so that if we have a disaster in the future, or we see a resurgence of COVID, a lot of what the back and forth was during the COVID was that this is something so new to us, and on so many fronts, we were just, making the rules as we go along because it had been so new. So this will be legislation that will be there in case we have another pandemic. And so it's requiring landlords to create a payment option for tenants. It prohibits landlords from charging late fees on rent payments to tenants without lost income during the statewide emergency. And there's a mitigation component where there's counseling because people are going to be so far behind in not only their rent, but so many bills. And it's just going to be insurmountable and overwhelming. So we're adding a mitigation component to help people with counseling moving forward.
Now, specifically that last provision that you'd mentioned, the landlord-tenant mediation program, can you explain how that would work and who oversees that?
Sure. So we're looking right now at common plea judges, your local judges, and we're still working on that. We've been having really good input with the Housing Alliance and the Philadelphia Urban League, and they actually had a package of 5 bills around this, 3 or 5. I'm getting all my bills confused, but that they're really the role model, and we're trying to look to them for some guidance with the financial component and the mitigation component. So all of this is still very much in the works. We hope to have something introduced by next week, but we want to have a complete bill that helps everyone, because I've been hearing from landlords, well, our bottom line is so short as well that we're going to be hurt by this. And of course, tenants are just so afraid of losing their homes.
How does your bill provide protections for landlords?
Under the CARES Act, $175 million has been released to help landlords and tenants. So it helps both. And every county will have their own process by which they'll distribute the money. For us in Monroe County, it will be the Monroe County United Way of Monroe County, and they're working very closely with Pennsylvania Housing Finance Agency. They expect to have a universal application out by July 6th. And so they'll work with the local agencies who will in fact work with us and hopefully use our legislation as guidance to get these monies distributed. But it's for both landlords and tenants.
You've compared the current situation to the Great Recession. What lessons have been learned from the Great Recession that you think can be applied to what we're experiencing right now with the coronavirus? I'm going to be really frank with you. I don't know that we've learned any lessons. I think what this pandemic has shown is the vast disparity in income inequality, and that we don't have these protections in place. So I'm hoping, we were able to get things together during the Great Recession, but I don't think they were legislation that was permanent. And so I'm hoping from this pandemic, we take the lessons from the Great Recession and the pandemic, and we codify in legislation that will always be there to protect us moving forward. What kind of early response are you hearing from colleagues about your proposal?
So it's relatively new. I believe we have about 20 co-sponsors. It just came out last week. We will be discussing it in great detail on Monday when we're in caucus, and we'll be reaching out and looking for more co-sponsors as we explain the bill and we unveil the bill and they see just exactly how it can help their constituents.
Earlier this month, lawmakers had passed a resolution to curtail the governor's disaster declaration. What do you think about this specific effort and other prior legislative efforts in recent months to try to speed up the governor's opening of restrictions?
I thought it was short-sighted. If we took anything away from this, we saw how other states opened up too quickly, and Florida right now is showing daily records of the highest numbers. They've had to close restaurants and things that previously were open. I was not in favor of any of that. I am a person who believes in science and facts and medicine. And while we can't know how to react to everything, I think overall, Governor Wolf and Dr. Levine did a good job of keeping us safe and healthy. And we were featured in The Economist as one of the states doing it right. And I think probably one of the smartest things Governor Wolf did was that regional contingency with Pennsylvania and New York and Ohio and Connecticut, so that we would all open up safely. We would all help each other find enough PPE and all of the materials that we need to open up safely. So I was not in favor of any of those bills. I didn't vote for anyone. I will not be voting to impeach the governor. And I think he's doing a great job. And when our numbers, we don't have this resurgence, I think we're really going to understand how he looked out for us.
Earlier in the week, a number of House Democrats called for a recovery plan that also includes labor and healthcare policies as well. What do you think is realistically achievable with both the House and Senate under a Republican majority right now?
Well, I'm hoping that we will direct some of these care dollars to help people who are uninsured, who have been affected by COVID. I know a good number of people who had the virus and they said it was relatively, easy to get through, but then they saw lasting effects, trouble breathing. I have a friend who's 45 years old, very active, has now a thicker layer lining around his heart. So these are going to be after effects that people are going to need to see doctors and have health insurance. So I hope that we're going to provide some emergency relief and some dollars so people who are underinsured or not insured can still be treated for the virus and the after effects.
I'd like to talk just briefly about higher education funding within the state budget. Now, this year's budget was done in two parts. The first part was just completed a few weeks ago, and higher education is flat funded for the foreseeable months. The second part of the budget is expected to be negotiated in November. As a former educator at East Stroudsburg University, what are your expectations for higher ed funding moving forward?
Well, honestly, it really depends upon what we see as revenue moving forward. Before this, we were 50th in the country for how we fund higher education. So obviously, I had a problem with that. Many institutions have had to make strong budget cuts and do things. And I know at East Stroudsburg University, I've followed Dr. Welsh and worked closely with her. And one of the universities that made smart cuts and made great improvements. So we're going to have to see. I'm really hoping that we've done this the right way and we're going to get a good July, August, and September. And hopefully those federal dollars will keep flowing, because we know that when we appropriate those dollars to the average working person, they're going to be spending them and they're just coming back to our economy. So it really is wait and see to what happens now that we're mostly opened up in Pennsylvania. I believe there are a number of counties going green next week. We're green as of today. So it's really going to depend on the dollars that come in moving forward.
State Representative Maureen Madden, thank you very much for joining us today.
Thank you. It was my pleasure.
We're joined today by Dan Doubet, Political Director for Pennsylvania Stands Up. For those that may not be familiar, can you explain what PA Stands Up does for progressive candidates?
Yeah, so we build progressive power with a multiracial base all across the state in 9 chapters spanning 11 counties all over Pennsylvania.
So Pennsylvania's primary election was delayed until June 2nd this year. What impact do you think both the coronavirus pandemic along with the newly passed voting procedures had on who actually came out to vote this year?
Sure. I think, there's a lot of context here around the way that the pandemic laid bare some of the underlying issues we face as a society, obviously from healthcare to racial disparities. And what we're seeing or what we saw on June 2nd was a lot of folks who were ready for big changes and were looking for leaders who took bold positions.
Voters were encouraged to vote by mail this year. Did that make a difference on who cast their ballot as well?
I think so. We certainly saw a huge partisan disparity. Obviously, in a primary, it's a little bit of a different number, and you can't suss out everything because there weren't the same number of competitive races, let's say, on the Republican side, or versus a competitive presidential year. But certainly that is interesting, and I think speaks to, we've seen, while locally and the Republican-controlled legislature passed Act 77 that allowed for mail-in voting, we've seen the president sort of disparage the practice and that sort of thing. So certainly, that can't be without an effect. And so, we also saw some racial disparity in whether or not it was who voted by mail and by in person. So certainly it was a factor.
Polling places were consolidated in some areas to allow for less people perhaps wanting to come out in the public or to volunteer at the polls. Do you think that enough arrangements were made to make sure that voters were not disenfranchised in light of this?
Right. I mean, I empathize with civil servants across the state who are doing their best to keep up with what was, it's an unprecedented global pandemic. But the short answer is no. I think in a lot of cases there was widespread confusion. You had sort of the scaffolding of a new system of voting through mail-in ballots and drop boxes. And that helped, I think, mitigate some of the problems. But, things like finding your website, finding your polling place through websites, those things weren't updated correctly in a lot of cases. There wasn't a lot of really good, robust public acknowledgement of polling closures, and a lot more we could do, if we are looking at another wave of the pandemic in the fall that we'll need to do to make sure people know where their voting place is.
How did the presence of the coronavirus pandemic affect the message itself that you had, perhaps coached your candidates to share?
Sure. I mean, I think, starting with the base, and we talk about, the kind of groups, the grassroots folks across the state, the thing is, I actually recently looked back to a text I sent in February that said, it was the first warning the CDC said that, hey, we may need to adjust the things that we're doing. And then reflecting back to the base, we needed to create a space for people to really process this, right? It's terribly anxiety inducing. In fact, my mom is actually battling coronavirus right now, so it's an ongoing thing. But when we talk to candidates, the primary way that we want to build power and to win is by building relationships with people who share our self-interest and share a sense of the common good. And that doesn't change, even though the tactics have to shift. Certainly, a lot of the work that we do is more effective generally in person. And so it created some sense for us to need to use digital means, certainly a lot of Zoom meetings, that sort of thing. And there is a distance there. But it also created some opportunities, right? So we could connect with people across geography, people who are in different parts of the state who maybe would otherwise not have been able to collaborate and to work together, were able to do so.
Now, in light of us being in a situation where social distancing was encouraged, can you tell us a little bit more about perhaps some of the more creative means that candidates use to get their message out through constituents, if not person to person? Right.
I mean, I think, one of the great things about technology is it enables lots of ways that we can connect with folks. Certainly we moved in a direction of making phone calls and asking our members to make phone calls and texts to other voters across different districts. And the candidates did the same. I mean, I think that there were certainly a lot more creative sort of online events, right? I know I participated in a couple of really fun sort of fundraising events where people were doing like a talent show, those sorts of things, and to try to get that sense of community, to build that relationship with people as best you can through means that are not ideal. And the truth is that a lot of people out there, we're going through a lot of this alone or in isolation. And so, even these things that are a little bit disconnected because of the means, we found a really good response on both the phone, the text, and through Zoom meetings, that sort of thing, because people were looking to connect with folks about what's going on in the world.
Lacking the presence of approved vaccine at this point, how do you foresee campaigns may operate differently leading to the general election?
Sure. I think one of the most important things campaigns can do is to maintain safety and to bring leadership as we continue to move through this crisis. I think another facet is about the economic impact that we're looking at. A lot of that is still yet to really unfold. there's been a moratorium on rents and a number of other things that will create a financial crunch for millions of Americans. And if you couple that with, what you're suggesting, which is that there may be another wave where there's more restrictions that are needed, or even in the absence of a wave, just additional precautions, it's going to be important for any politician or elected official to demonstrate the kind of leadership by modeling what it looks like to communicate, to go about your life, but to do so in a way that considers the risk that's involved with in-person contact and close contact.
The Philadelphia Inquirer reported that at least 7 progressive candidates were successful in this primary. What factors do you think contributed to that?
Well, certainly, I think, even before the kind of the crisis that we're in around Corona, we've seen decades of income inequality just continue to expand, the crises that we face around healthcare. And a lot of that was just made acute, right? I mean, we had among the highest percentage of unemployed here in Pennsylvania in the wake of the coronavirus. And when your healthcare is tied to your employment and you lose your employment because of a pandemic, it's sort of a perfect storm where people are looking for the kinds of solutions that will build for a society that works for all of us, so that people don't slip through the cracks. And I think that what we saw in a number of the places, in a number of the races, were folks that were maybe thinking in terms of a certain level of normalcy or complacency around the way things have been, and even in reaction to the moment with Corona, we're not quite prepared for the level of discontent and the level of needs that haven't been met by for the people over a period of decades.
What does it mean to you that several of the successful candidates this primary were not endorsed by the Democratic Party, and yet they be some incumbents? What does that give you a broader message, perhaps?
Right. I think that there's a couple of messages there. I think the first is that we are looking at a time when people are dissatisfied with the leadership that they have. I mean, to some extent, even with the rise of Donald Trump, in many ways, that's a reaction to a sense that people who are in power are not reflecting people's interests, and so, or people's self-interest. And so, in each of those cases, what you saw were challengers who were taking on incumbents who, perhaps had done some good things, but were not meeting the needs of folks. And so I think, that sort of arc is bending towards an interesting time. Where in 2020, we're also in the last cycle of redistricting, right? So this is the last time we'll use the maps that were created in 2010. And those maps were created by a computer program to help Republicans. Over the span of a decade, demographics shift, people move, and so there are more competitive places. And so as we go into the next round of redistricting, it will be interesting to see where races are competitive, both in primaries and generals, based on where the new alignment is of where people live.
We've been speaking with Dan Doubet, Political Director for Pennsylvania Stands Up. Thank you for joining us today.
Thank you. Thanks for having me.
We're joined today by Dr. David Damsker. He's Director of the Bucks County Health Department. Bucks County is scheduled to move to the green phase of reopening on June 26th. Do you think that the governor's plan of gradual reopening and lifting of restrictions has helped to mitigate the coronavirus in Pennsylvania?
I absolutely do. Of course, here in Bucks County, we think it could have moved a little faster. But overall, the idea of shutting things down, allowing the virus to not spread as quickly as it was, because early in March, when things started ramping up, we definitely were seeing some overall quick spread in certain situations. So there's something had to have been done, and we are glad that it was shut down. And opening back up, however, has been a little slower than we wanted. But overall, yes, the technique that they use has worked.
So what happens after a county goes to the green phase? Is there another benchmark that you're looking for a further lifting of restrictions? Or are you just in a holding pattern until there's a vaccine?
Yeah, I believe we're in a holding pattern until there's either a vaccine or until the number of cases kind of levels off permanently. We say Bucks County has 5 cases every day, and because there may never be a vaccine. And I don't believe these restrictions should stay in place forever. So I think it's good for several months to see if there's going to be a vaccine development. And what happens is, again, if we see a permanent sort of baseline level of 5, 10 cases a day, then we start treating it like other diseases, like measles and mumps and the flu, where we do have cases, and we kind of go along with that. But I would say for the next 3 to 6 months, at the very least, we're going to be in green under these restrictions. And I think that we're hoping by the end of the year, we have a vaccine where we can start to make some changes.
Back in March, when the coronavirus initially really appeared in Pennsylvania, there were concerns about whether or not healthcare facilities would have things like ventilators available to be available for the potential caseload of coronavirus cases. How have Bucks County health facilities and hospitals done at being prepared and having enough equipment ready in the event of a surge?
Yeah, and that's been the beauty of what the entire process was, you know, keeping that initial surge to a lower level. Hospitals, as a matter of fact, have been underutilized in Pennsylvania. Some hospitals are way down, and they had to, some even had to furlough staff in some ways because they weren't doing elective surgeries. The ER visits are down, but overall, that problem itself was a good problem to have relative to what it could have been. So all the hospitals, there's a nice supply of state ventilators available to any hospital that needs them. If we were to have a second surge, we hope we don't have one. But we feel like the hospitals have plenty of PPE available and plenty of ventilation, plenty of ICU space.
What tactics do you think have been most useful in curbing the spread of coronavirus?
I know for sure here in Bucks County, having things like bars closed. We had a lot of early cases in bars where people, unfortunately, when you start drinking, people start to forget about social distancing. They start sharing drinks. They're not paying attention to what they're doing. And shutting down those kinds of facilities was very helpful. Certainly, we don't know what the impact was of shutting down every store in the county, but certainly keeping people in their homes, not spreading it out to other people made a big difference. And contact tracing, which we've been doing all along, was made much easier because if you got sick, because you're a nurse at a hospital, you haven't been anywhere else but the hospital, and your family hasn't gone anywhere. So that virus had nowhere to go but you and your household, right? So things like that did make a big difference.
How would you characterize the availability of both testing and contact tracing in Bucks County?
Bucks County contact tracing, we've done it since the very beginning. I think we're the only county potentially in the state of Pennsylvania that did it the entire time. We feel confident we have it there. Testing is easy to get if you have symptoms. It's still a little bit harder to get if you don't have any symptoms because some of the facilities want you to have some kind of symptom to get tested because the PCR test, the nasal swab, the results are a little bit more difficult to interpret if you don't have any symptoms. It picks up dead virus in your nose. So you could have been sick a month and a half ago and you think you're sick now, but in reality you weren't. So it's a much better test when you're symptomatic than it is when you're asymptomatic. But eventually, though, we would like to have it available to anybody who wants one.
The southeastern counties in Pennsylvania have experienced some of the highest caseloads in the state of coronavirus. What do you see as the biggest risk factors of reopening the southeastern part right now?
I would say, obviously population density, any area like New York City, anywhere that has more people has more spread. But I do think that having the most cases in the southeastern Pennsylvania has sort of given us a new attitude and say, hey, it was pretty bad here. And I think it's giving overall people walking around now that we're going to green and yellow, people are wearing masks. They're being a little careful when they go to a party with people, they're social distancing, and they're just taking overall care that they might not have taken if we didn't get hit hard, for the last several months.
There's been some discussion about the potential for a second wave of coronavirus cases. Are you anticipating that to happen, and if so, when?
I don't believe there's any data to show that there will be. I'm not saying there can't be, but if we keep things in this new normal that we're talking about, that everyone keeps using that phrase, and we're all wearing masks, and we're doing the social distancing, even if not everyone does it, if we do it much more than we were. I mean, I've used more hand sanitizer in the last month than I did my entire life. So everyone's doing things a little differently, and we're hoping by that technique we'll keep the second wave from coming.
Are there lessons that you've learned over the last 3.5 months that you think will be useful in planning on how to proceed forward until a vaccine becomes available?
Yeah, I mean, it's kind of boring and safe, but, we've been talking about for how many years? I've been in public health for 20 years, and we're talking about the ways to prevent flu and other diseases, about washing your hands and all this stuff. Nobody ever did it. And now people are actually taking it seriously. I think we may even see a low case number for our flu season this year because it's still droplet spread, just like, coronavirus and influenza are spread the same way, droplet spread. And if everyone's doing those same things, if people walking around with masks and face shields and washing their hands, I anticipate us having a very light flu season too. So I think that even if not 100% of people do all this, there's a certain percentage of people that refuse to wear masks and don't want to do anything. And there's other people that are hypersensitive to it and wear masks to do everything. So we're hoping that overall balance will keep us from having any, maximal numbers of cases.
Dr. David Damsker is Director of the Bucks County Health Department. Thank you for joining us.
Thanks for having me.